Hi everyone, Dr. Richard Lai here with Study Acupuncture with me. So today's episode is on the Yang Qiao Mai. Now the Yang Qiao Mai is one of the extraordinary vessels. So before we get into all of that and more, let's hear a quick word from our sponsor. This episode is sponsored by me. Please go to www.studyacuwithme.com to sign up for my email list. When you sign up for my email list, you get free study guides right to your email. So go to www.studyacuwithme.com to sign up today. Alright, and we're back. So today we're going to talk all about the Yang Qiao Mai, and at the end of the video, we're going to talk about the clinical manifestations of the Yang Qiao Mai. Now those clinical manifestations are a really important topic for the board exam, so make sure you stick around to the end to review those with me. So in order to understand the Yang Qiao Mai fully, we're going to break it up into smaller parts, because that's the easy way to understand it, to understand every single segment so that you understand the whole topic. And that's actually a really good way to tackle almost anything in life as well. And I actually have a YouTube video where I talk about how I plan out my week, which is that I segment as much of the week and as much of the day as possible. And I'll actually put a link to that video in the description below, so go check it out if you want to put some processes in place that'll help you control your day and your week instead of just trying to survive the chaos without a plan. Now, when it comes to studying, I try to tackle it in the same exact way, which is that I break up a topic into sections that I myself will find manageable, and then I work to understand each of those segments. So for the Yang Qiao Mai, for example, I broke it up into 4 basic parts. So part number 1 is just the general front of mind theory of the Yang Qiao Mai. Part number 2 is the pathway of the Yang Qiao Mai. And then part number 3 is the clinical applications of the Yang Qiao Mai. And then part number 4 is the clinical manifestations of the Yang Qiao Mai, which is basically what the patient's going to present with if there's an issue with the Yang Qiao Mai. Alright, so first, the general front of mind theory of the Yang Qiao Mai. So we already know that it's an extraordinary vessel, which one of the functions of the extraordinary vessels is that they act like a reservoir. So as a reservoir, they absorb any excesses from the main channel. But with the Yang Qiao Mai, it specifically absorbs the excess of yang in the body. And actually, it absorbs excesses of yang in the head. So like for example, in the case of liver yang rising or liver fire blazing or any other patterns that actually will result in an excess in the head, the Yang Qiao Mai is the first line of defense in bringing the body into equilibrium by absorbing those excesses off. And then with the Yang Qiao Mai, because it's an extraordinary vessel, there's going to be opening points and there's going to be coupled points. So the opening point of the Yang Qiao Mai is UB62, and then the coupled point is going to be SI3. We also have a Shi cleft point of the Yang Qiao Mai, which is UB59. And with Shi cleft points, of course, we know that they can be used for acute conditions, and they can also be used for pain conditions. Alright, now let's talk about the overall pathway of the Yang Qiao Mai. So the Yang Qiao Mai doesn't have any points of its own, but it shares points with the urinary bladder channel, the gallbladder channel, the small intestine channel, and the stomach channel. And the Yang Qiao Mai, it actually starts in the heel, and it emerges at UB62. UB62 is actually the opening point of the Yang Qiao Mai. Now from UB62, the Yang Qiao Mai goes around the heel. It goes to UB61 and then UB59. Now UB59 we know is the Shi cleft point of the Yang Qiao Mai. Now from UB59, the Yang Qiao Mai goes up the side of the leg, goes up along the IT band, and it goes to gallbladder 29. Now gallbladder 29 we know is halfway between our ASIS and our greater trochanter. This is basically our hip area. Now from gallbladder 29, the Yang Qiao Mai is going to go up along the side of our abdomen, and it's going to go behind our rib, and it's going to go to our posterior axillary fold, which the posterior axillary fold is that skin fold that your arm makes when it's at your side. And that skin fold is actually where your small intestine channel is. And actually, it's exactly where your small intestine 10 is. Now, from small intestine 10, the Yang Qiao Mai is going to go to LI15 and LI16. Now, these points are at the top of our shoulder. From there, it's going to go to our neck, where it's going to connect with stomach 9. From stomach 9, the Yang Qiao Mai is going to go over our jaw, over our cheek to stomach 4. Stomach 4 we know is at the corner of our mouth. From there, it's going to go up our cheek to stomach 3 and to stomach 1. Stomach 1 is right below our eye. And then from there, it's going to go to the inner canthus of the eye. And that's where it's going to meet with the Yin Qiao Mai. I also have a video on the Yin Qiao Mai on YouTube. And I mentioned there that the Yang Qiao Mai and the Yin Qiao Mai both meet at UB1. Okay, so then from UB1, the Yang Qiao Mai is going to go up to the forehead, over the top of the head, and it's going to go all the way back to GB20. So that's the whole pathway of the Yang Qiao Mai. Okay, now let's talk about how you can use the Yang Qiao Mai. And there's 5 different ways that you can use the Yang Chao Mai. Number 1, you can use it to absorb excess of yang in the head, which we talked about this before when we talked about the general front of mind theories of the Yang Chao Mai, which is that when there's excesses happening in your head, and when I say excess, I mean in terms of 8 principle excess, because some people, they get confused when I mention excess, like what's excess yang? Well, we have to remember, when we're treating patients, we apply the 8 principles to our evaluation, which is exterior, interior, excess, deficiency, hot, cold, and yin and yang. So an excess in the head can be something like heat. An excess in the head can be something like wind. It can even be excess yang energy going up to the head, and that could be because of the Yang Chao Mai. So clinical application number 1 is that the Yang Chao Mai can absorb excesses of yang going to the head. And that's because it's an extraordinary vessel, and therefore it acts like a reservoir. So if your patient's experiencing manifestations related to patterns like liver yang rising or liver fire blazing, the Yang Chao Mai can be activated to clear those excesses. All right, now clinical application number 2 has to do with our eyes. Now the Yang Chao Mai and the Yin Chao Mai, they're closely related in terms of sleep. Yin Chao Mai, we went over in another video that it brings yin energy to the eyes to close them. And if you didn't get to listen to the Yin Chao Mai episode, I'll include a link in the show notes below. Now again, the Yang Chao Mai brings yang energy to the eyes to open them. So that means if the patient is going through something that's causing their eyes to be closed all the time, then the Yang Chao Mai can actually be used to help open the eyes. What's something that can affect your patients that would cause their eyes to close all the time? And the answer to that is somnolence. Because somnolence is when your patient is sleepy all the time. Somnolence is when they're struggling to keep their eyes open. They're tired all the time. So we can use the Yang Chao Mai to bring more energy up to the eyes to open them. Now the question is, how do you use the Yang Chao Mai to bring yang energy up to the eyes? And the answer is that you can activate the Yang Chao Mai by using the opening point of the Yang Chao Mai. And now that point is UB62. So with UB62, you can tonify the Yang Chao Mai and bring yang energy to the eyes to open them. And actually, you can also use the Yang Chao Mai to treat insomnia, because with insomnia, the patient's eyes are always open. So potentially that patient's Yang Chao Mai may be bringing too much yang energy to the eyes. So how do we reduce the amount of yang energy going to the eyes? We can either, number 1, reduce UB62, which we know that UB62 is the opening point of the Yang Chao Mai. So we can reduce the amount of yang energy going to the eyes by reducing UB62. Or we can tonify kidney 6, which Kidney 6 is the Yin Chao Mai's opening point. So if we tonify kidney 6, we can bring more yin energy to the eyes, and that's going to help close the eyes in cases of insomnia. All right, next we have clinical application number 3, which is that the Yang Chao Mai can be used to treat mental issues. Now, this actually has to do with our clinical application number 1, which is with the excesses in the head. So when there's an excess in the head, like with liver yang rising or liver fire blazing, there could be mental changes. Like for example, there could be confusion, there could be agitation, there could be things like insomnia. Now, these are all mental issues that can be treated using the Yang Chao Mai. Next, we have clinical application number 4, which is that the Yang Chao Mai can be used to treat unilateral backache and sciatica issues, which actually in real life treatment, I find this to be really useful, especially using UB59 and GB29 with Easton. So I use this for my patients who are runners or cyclists, basically anyone who does repetitive motions and they're having pain on one side or honestly even both sides, which for that, I'm just going to double down and do those points bilaterally. Now, with the Yang Chao Mai, we said before how it shares points with the UB channel and the gallbladder channel. So with backache, with sciatica, that's actually along the pathways of those two channels. And that's why the Yang Chao Mai is so effective in treating these types of conditions. All right, now lastly, we can use the Yang Chao Mai to treat hip issues. Now, I usually incorporate for my patients with hip-related pain, I incorporate GB29 as a local point, and I may use some extra insertions in that area depending on what they say to me, like if their pain radiates this way or that way. And then I'll include a distal point like UB59 or UB62, just so I cover more surface area. So I cover from GB29 all the way down to UB59 or UB62. All right, so those are all the ways that you can use the Yang Chao Mai in treatment. All right, now let's talk about the clinical manifestations of the Yang Chao Mai, which these clinical manifestations are actually frequently asked about in the NCC AOM board exam. So here I'm going to show you the manifestations from Machiocha and from CAM. Now, I want to remind you, don't be worried about how there's two references. And don't fall into the trap of trying to memorize, oh, this one says this, but this one says this, because they pretty much mean the same thing. For example, from Maciocha, we have insomnia. We also have epilepsy. And with Maciocha, it specifies that these epilepsy episodes, they happen during the day. Now, if you look at the CAM manifestation, it just says epilepsy. It doesn't specify daytime or nighttime. But from a clinical standpoint, it makes sense for it to be daytime because the Yang Qiao Mai brings yang energy to the eyes to open the eyes, and does this as the day comes closer because the Yang Qiao Mai brings yang energy to the eyes to wake you up, and that actually establishes your sleep-wake cycle. And we know yang time is daytime. So if there's an issue with the Yang Qiao Mai, more likely there would be an epilepsy episode in the daytime. All right, next we have pain and redness in the inner corner of the eye. So this is the inner canthus of the eye. And if you look at CAM, instead of saying corner, it says canthus. So again, it's the same thing. Now, this also has to do with the pathway of the Yang Qiao Mai. Like before, how we saw the Yang Qiao Mai goes to UB1, which UB1 is at the inner canthus or the inner corner of the eye. Next, we have backache. We have sciatica with pain along the outer aspect of the leg. We have tremors of the leg, which in CAM, it just says pain in the back and lumbar area. So instead of backache, it says back and lumbar area pain, which this one also has to do with the pathway of the Yang Qiao Mai. The Yang Qiao Mai, we saw it shares points with the UB channel, and it also shares points with the gallbladder channel. So an issue with the Yang Qiao Mai can actually result in pain in these areas. All right, next we have the foot turning inwards. We have tightness of the muscles of the outer aspect of the leg. We have flaccidity of those of the inner aspect. Now this one has to do with that classical presentation of pathology in the Yang Qiao Mai, which is that there could be an imbalance with the outer muscles versus the inner muscles, where the outer muscles are going to be tight and the inner muscles are going to be loose. And so what's going to happen is that the foot is going to be drawn outwards, and that's because of the tightness of the outer muscles. Now, Maciocha says that the foot turns outward. CAM says there's eversion of the foot. Eversion is just a fancy way of saying the foot turns outwards. And then with Maciocha, it says tremors, and CAM, it says spasms of the lower limbs, which they both pretty much mean the same thing. And then Maciocha also has windstroke, hemiplegia, aphasia, facial paralysis, severe dizziness, chills, fever, headache, and stiff neck. Now these have to do with the excesses in the head, which we talked about before, that the extraordinary vessels, they act as a reservoir. And the Yang Qiao Mai especially acts as a reservoir to absorb excesses of yang in the head. And then Maciocha also includes manic behavior, manic depression, fright, and seeing ghosts. Now, these clinical manifestations have to do with one of the clinical applications that we talked about before, which is that the Yang Qiao Mai can treat mental issues. And then lastly, but not leastly, we have the inability to raise the leg when lying down. Now, I think that this is a crossover with the straight leg raise test, which the straight leg raise test is exactly how it sounds. It's basically a special test where you try to find out if there's an issue with the discs in the spine or if there's an issue at the nerve roots. So how you do this test is basically you have your patient lie on their back and you bring one of their legs straight up into the air until they feel pain or discomfort either in their back or going up their leg. If they have pain or discomfort, that could mean that there's a nerve root issue or a disc issue. All right, and that brings us to the end of this episode. Make sure you subscribe so you don't miss out on the weekly episodes. And if you want a study guide to go with each theory-based episode, go to my website, www.studyaccuwithme.com to sign up for my email list. And if you found this episode helpful, please interact with it. You can interact with it by either leaving a comment or sharing it with a friend. You can easily tap the share button and put it on your social media, or just send it to a friend. All right, everyone, until next time, God bless and happy studying.